Hello friends, I am Dr. Harinder Singh Bhalla. I am a homeopathic physician. Welcome to my channel. Today I am going to talk about hair fall and its causes and what treatments or measures we can take to treat it. So let us start with the topic. What is hair fall? Now, hair loss to an extent in which the scalp skin is visible abnormally is called alopecia. It can be permanent or temporary. In permanent condition, the hair follicles are damaged due to scarring in the conditions like lichen planus or discoid lupus erythematosus. And in temporary condition, there are some endocrine diseases or the conditions like alopecia areata. Now, there are some causes behind the hair fall. I will talk about them one by one. Now, first one is the family history, heredity. This is the most common cause of hair fall, hereditary conditions, and it happens with aging. This condition is also called androgenic alopecia, male pattern baldness and female pattern baldness. Now, it occurs gradually and it has a very predictable pattern. For example, there is a receding hairline and bald patches in males, and there is thinning of the hair along the crown of the scalp in females. Now, second to this is the hormonal changes and some medical conditions. In hormonal conditions, the conditions like pregnancy, childbirth, menopause, or this thyroid conditions, for example hyperthyroidism, hypothyroidism, they can lead to hair loss. And some medical conditions which are related to the immune system related conditions, for example this alopecia areata. In this, the hair follicles are attacked and hair loss occurs. And there is an infection of the scalp. For example, the infection known as ringworm infection. Ringworm, there is circular pattern bald patches on the scalp. So these are some conditions which can lead to hair loss. Then there is condition of stress. That stress can be physical or mental. Mental stress means if there is loss of a beloved one, there is death in the family, it can lead to hair loss. It has been seen. Or there is a physical stress. For example, there is extreme weight loss. That can also lead to hair loss. Or if a person has recovered from a high-grade fever, very high fever he suffered from, and after recovery he faces sudden hair fall, hair loss. So these are the conditions. Then there are some drugs, the medications that can lead to hair loss. For example, the drugs that are given to treat the cancer, arthritis, high blood pressure, depression. So these are some conditions. There are many more. The drugs, they do have the side effects that can lead to hair loss. After that, there is a hair pulling disorder. Hair pulling disorder that is known as trichotillomania. In this disorder, the person needs to pull the hair from the head, from eyebrows, from eyelashes. That necessity to pull the hair lead to hair loss. This is a mental condition. Then there is hair styling and treatments which can lead to hair loss. For example, the hair styling, they need to pull the hair so much to make the styles. That will put much pressure on the hair follicles and can result in hair loss. There are some treatments, chemical treatments of the hair, hot oil treatments of the scalp that can lead to permanent damage of the hair follicles and can lead to permanent loss of hair. So these are some conditions which are the causes of the hair loss. After that, now there are some deficiencies which can lead to hair loss, and if they are corrected, the hair growth can be regained again. For example, the deficiency of vitamin A. Vitamin A is responsible for the secretion of the sebum and moisturizing of the scalp and providing health to the hair. So with the deficiency of vitamin A, the skin will become dry, the hair follicles will be damaged. That can lead to hair loss. Then there is vitamin B deficiency, which can lead to hair loss. Vitamin B is responsible for creating the red blood cells. which are important to take the oxygen and nourishment to the different parts of the body. So indirectly they will damage, the deficiency of this vitamin will damage the hair growth. Then there is deficiency of vitamin C. Vitamin C is a very important antioxidant, and it is helpful to fight or neutralize the free radicals and protect the body from the bad effects of these free radicals. It also helps in the synthesis of the collagen. Collagen is a protein which is an important part of the hair structure. And it also helps to absorb the iron. And iron, it is an important mineral for the hair growth, because iron takes oxygen to different parts of the body in the blood. So deficiency of vitamin C, deficiency of iron can lead to hair loss. Then there is deficiency of vitamin E. Vitamin E acts as same, it is an antioxidant. It helps to fight the free radicals and protects the body from the bad effects. So deficiency of vitamin E can also lead to the hair loss. Then there is deficiency of vitamin D. It is supposed that vitamin D helps in the formation of the new follicles and results in the hair growth. And deficiency of this vitamin can lead to hair loss also. Then there is another mineral, the zinc. Zinc is very important mineral. It helps in the growth and repair of the hair. And it also regulates the functioning of the glands around the hair follicles, so that they can secrete the secretions and keep the hair healthy. So deficiency of zinc can lead to hair loss. But the excess of zinc can also lead to hair loss. So it has to be adequate, it has to be in balance. Similarly in the vitamin A, excess of vitamin A will lead to hair loss also. And another factor is the protein. The adequate amount of protein is necessary for the proper health of the hair, because hair are all ultimately, they are all protein. They are made from protein. So it is important to have adequate amount of protein in the diet so that the hair can remain healthy and shiny. So these are some things, some points that are important for the hair growth and hair health. If by completing the deficiencies, by just taking care of everything, if still you are having the hair fall, then there are important medicines in homeopathy that can treat hair fall very well. But for that proper case taking is important. It is the mandatory step to take the case properly. The individualistic symptoms of a person has to be taken before giving any medicine. And in homeopathy, hair fall can be treated very well, until and unless the permanent loss is not there. The hair follicles should be intact. There should be hair roots so that they can grow again. So that is the important point. So I think this video was of help to you. If you liked my video, do like it. Subscribe my channel. Do not forget to press the bell icon so that in future you can receive my videos that I will make. So thank you for watching and take care.